Hello guys, welcome to Dr. Fire. So this video is specifically going to be on the external nose. Nose is a pretty good organ, which is sharp for a few people, blunt for a few people, blah blah blah. The nose is like the index of mind. Okay, I'm kidding, it's the eye. But nose diseases are plenty. So we'll see in this video. We'll mainly focus on the diseases which are seen on the external nose. So like there are like a good number of diseases, like 10, maximum 15 diseases. We will be seeing everything, not in detail, in a crisp manner. We will see everything in a crisp manner and try to grasp whatever important points are there about each and every disease of the nose. So a new attempt has been tried by compiling the etiologies, the clinical features, the investigation and treatment together of different diseases of the nose together, because I feel like if we are going to contrast the etiologies, contrast the treatment, we'll be able to have a better perspective of the particular disease as such. So let's get started. We've got the external nose, and first we will see the etiologies, and then I will show you the pictures of how each of these diseases look like, so that we can give a holographic view. We can get it. Okay, let's start. The first disease we're going to see is cellulitis. So before going into that, we'll just see what all diseases are there. Cellulitis, saddle nose, crooked or deviated nose, rhinopharma. These are like diseases which are visible outside to the naked eye, just like nose diseases. All right. So cellulitis is like it is inflammation of the cells. It's just like self-explanatory term. I'll show you the pictures, but like the cause of this inflammation is going to be a bacterial infection. So it's either like a streptococcus or a staphylococcus. And so it's like it is extending from the lowermost part of the nose, like the part we are nose picking. So like that part, that's called the vestibule. So like the lowermost and the outermost part of the nose, that's the vestibule. It's like a vestibule is like a useless part, but like technically this particular part is useless because like it just like covers up our half the finger while nose picking. So that is the vestibule. So like the cellulitis of the nose is like mainly from infection of the vestibule. Especially the infection is going to be acquired because of nose picking, so the vestibule gets infected, and from that cells get infected. Okay, that was cellulitis etiology. Let's see how cellulitis look like. Yeah, that's how cellulitis look like. It's just like red, swollen, and painful nose. That's how a cellulitis look like. We'll see the diseases first, the etiologies, and then go to the pictures. Saddle nose is like a kind of a nose which is deformed. So it's one of the deformities of the nose, we could say. It's the cause could be multiple. It can be a trauma to the nose. So like if you got into a fight when you were a kid and then you end up getting a saddle nose, all right? Or sometimes you go to a ENT surgeon, he's gonna like remove a part of your nasal septum, which is nothing but like the septation between the right and left nostril. So like that septum, if the surgeon is gonna like remove so much in a surgery, then you can get a saddle nose. Saddle nose is kind of like a depressed nose, just like the seat of the horse back. So it's kind of like a depression over the dorsum of the nose. So if you could imagine first before seeing the picture, it would be better. So that, and another important reason why you get a saddle nose is when your septal cartilage, as you know, septum has like bone and cartilaginous part. The septal cartilage can get hematoma, which is a blood clot, or it can get an abscess, which is just like a pus. So these kind of diseases will be destroying the septum. So like it reduces the thickness or like width of the septum. So you kind of get like a depression on the dorsum of the nose. That's saddle nose. Fourth is like an infection can also cause a saddle nose. Infections like TB, syphilis, leprosy are like notorious to cause it. Saddle nose kind of looks like that. Okay, so it's like a depressed nose, right? Yeah. Next nose is a crooked nose or a deviated nose. So like it's kind of like a saddle nose, but like it is deviated to one side. Saddle nose is a depression. Deviated is like either the nose is deviated to the right side or the left side. The crooked nose and deviated nose, the etiology can be the same, but obviously the clinical feature looks kind of different because, like in a crooked nose, if you're going to see the dorsum of the nose alone is deviated to right or left side, but the tip of the nose is in the midline. But a deviated nose, the entire nose is deviated to one side. So, like the tip of the nose is going to be on the right side or the left side. So that's the main difference. The crooked nose, the tip is in the midline, the nose tip. But the deviated nose, the tip of the nose is deviated outside the midline. All right. So the causes could be a birth or neonatal childhood injuries, which are not recognized immediately. But as the person grows, it becomes prominent. And one main thing is the deviated nose is kind of look hard on like a lot of people, like McDreamy from Grey's Anatomy. So like there could be way to remember that Caucasians have more chance of developing a crooked or a deviated nose. It's because of the fact that the anteroposterior diameter, otherwise specifically speaking about with respect to the skull bones, the occipitofrontal diameter, so like the anteroposterior diameter of the skull of Caucasians is a little long. This is like the longest diameter for them, so like it's longer than any other race. So while the person passes, like when the baby passes through the genital canal of the mother, so like if it is passing through it, it can get deviated to one side. So like the nose is the most prominent part of the anteroposterior diameter, so it makes sense. So a crooked or deviated nose kind of looks like, okay, this is a hump nose. We will see a hump nose in detail very soon. So this is like this is a crooked nose because see, technically the tip is in the midline, more or less in the midline, but the dorsum is deviated. But the tip itself is in the right, towards the right side. So that's a deviated nose. So this is a deviated nose. This is a crooked nose. This is a hump nose. This is how a hump is like the opposite of a saddle nose. Saddle nose is like the dorsum is depressed, but the hump nose, the dorsum is elevated. This is a saddle nose. This is how a cellulitis look like. All right. So one important thing, or maybe you can say, I like this particular disease because it has the word potato in it. So it's a potato tumor. It's otherwise called rhinophyma. It's called a potato tumor because it looks like a potato. I'll show you the picture. Hypertrophy of the sebaceous glands at the tip of the nose because of long-standing disease called acne rosaceae. So honestly, it's just like a type of acne which kind of like aggregates itself at the tip of the nose, right? So that is rhinophyma. It's just like sebaceous glands or like sebum secreting glands, which kind of makes everything look shiny. So that is what rhinophyma is. Well, this is a picture of dermoid cyst. So like there's a child at the dorsum of the nose, you get a dermoid cyst. So the second picture shows like a sinus, so it's like dermoid cyst with a sinus. This is like a dermoid cyst with a sinus. This is like, we'll see this very soon, it's like an encephalocele, alright? And this one's like it's kind of like a basal cell carcinoma. This is a potato tumor. This is like the rhinophyma, all right? So this disease is a squamous cell carcinoma. So we see the clinical features of all the diseases we saw till now. It is cellulitis. It's a red, swollen, tender nose. That's what we saw. Saddle or depressed nose is like the depressed nasal dorsum, either the bony or the cartilaginous part, or both the parts can be depressed. Hump nose is like an elevation of the same. Crooked nose is like the tip is in the midline, dorsum is deviated. It's just like a revision because I told most of these points previously. Deviated nose is like the tip is deviated to one side but the dorsum is straight. Dermoid cyst is a simple dermoid, congenital. It's a congenital problem. So it's a subcutaneous midline swelling. It's located in front of the nasal bones. But if it's a dermoid cyst with the sinus, it is a subcutaneous swelling in front of the nasal bone, but it has a pit or sinus in the midline, and sometimes through the sinus opening, a hair may be protruding through it. Okay, sometimes what happens is the ENT parts are like present in the head, right? So like they can be communicating with the brain inside of the head. So sometimes it can communicate with the covering of the brain to the meninges. Okay, so just why it's going to lead to meningitis if the sinus cyst gets infected. All right. Encephalocele or meningoencephalocele, that's like a congenital problem again. It's a herniation of the brain tissue with the meninges. And clinically speaking, if you're going to touch it, it's going to be pulsatile and it's a midline swelling. Glioma is a nipped off portion of the encephalocele, so like the person has encephalocele, but like it's just like cut off, the stalk is cut off. Rhinophyma is the potato tumor I showed you. It's pink, it's lobulated, there's like superficial vascular dilatations. And because the potato tumor looks like that, the person's vision is obscure, the breathing is obscure too. Because like when he's looking front, the nose is like pretty big, so he's not able to see properly, right? That was rhinophyma. It's pink in color. And basal cell carcinoma is otherwise called a rodent ulcer. It's papillopearly nodule, but like kind of looks like an ulcer with rolled edges. We will see this in detail in surgery videos. Squamous cell carcinoma is mostly present at the side of the nose, right? And melanoma is like a weird black mole. Basal cell and squamous cell carcinoma more or less looks similar in most of the pictures, but like if it's at the tip of the nose, almost at the midline, it's going to be basal cell, but it's like in the side of the nose is like squamous cell carcinoma, but like it's not a clear-cut distinction, but yeah, could be used as a aid to diagnose diseases. But obviously we go with biopsy. Treatment for cellulitis is just like infections, so systemic antibiotics. It's a painful condition, so we give analgesics and hot fermentation. Hot fermentation is nothing but you're going to ask the patient to take an iron box and like heat up a cloth and put it on his nose. Saddle nose, it's a depressed nose, so we augment the nose, so like we make the nose look bigger, especially at the side of depression, so it's called an augmentation rhinoplasty. And a hump nose is called a reduction rhinoplasty because it's big, we reduce it. It's a reduction rhinoplasty. Crooked or deviated nose is just like septorhinoplasty or a rhinoplasty. Because all these are like a plastic surgery because technically, as such, the saddle nose, hump nose do not cause any other problem other than being awkward on the front of the patient's face. Which is why it's a plasty, it's plastic surgery. So like a rhino means nose, rhinoplasty. Get it? For a dermoid cyst, a resection or a cyst and repair of the bone is done. Like ENT and a neurosurgeon is needed because like sometimes it is in communicating with the meninges and stuff. Encephalocele or meningoencephalocele, we're just gonna like, there is a bony defect through which the encephalocele, the brain herniates outside of the skull. So like we have to remove it and like repair the bone, right? That's it. Glioma is just like the same thing, but do it in an extranasal approach. Rhinophyma is like a potato tumor, so like you have to reduce the size of the tumor, so downsize it and like allow reepithelialization, meaning let's allow the skin to form over it. And the resection of the tumor with the skin grafting resection is done with a CO2 laser or a sharp knife. That's like rhinophyma. Just remember, rhinoceros exhales carbon dioxide, so like rhinophyma needs a carbon dioxide laser. Well, squamous cell basal cell carcinoma is like not much of the problem for ENT surgeon because like general surgeons operate on it. And like superficial disease, we just give like radiation. For squamous cell carcinoma. For advanced disease, we do a wide excision, some 1.5 centimeter around radius like that. And lymph node is like remote block dissection. For a basal cell carcinoma, it's doing cryosurgery, radiation, surgery. It is a locally invasive tumor, so like a 5 millimeter healthy skin margin has to be taken away, okay? If it's a recurrent or an extensive lesion, you have to do a wide excision. In the melanoma, the treatment is excision. So like as a quick recap, we'll just see the diseases, how it looked like. So this is how a cellulitis look like. This is a saddle nose. This one's a hump nose. What is this? That's right. This is right. Coming down, what is this? This one's a deviated nose. This is right, dermatist with sinus encephalocele, and this is like a carcinoma. Thank you.